tell me, I'm going to touch your face and you just tell me if it's sharp or dull, okay?
Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Perfect. All right. And then cranial come behind so that I could check his trachea. So we go past his thyroid cartilage or Adam's apple and go down to the cricoid cartilage, and then where the suprasternal notches, and then I don't feel any masses, but you can give me a nice swallow, and you can feel it slide between your fingers. And then I'm just going to palpate and palpate. No noted masses or swelling. Again, everything's midline. And with that, we're going to do the lymph nodes. So we're going to palpate his lymph nodes, checking for swelling. So we'll do the periauricular in front of the ears, postauricular, tonsillar, submandibular, submental. We're doing anterior cervical chain. And if you turn your head to the left, and then we do the posterior cervical chain. You turn your head to the right. Same posterior cervical chain. And these would be for deep palpation. And then we'll do this supraclavicle clavicular lymph nodes. There's no noted firm or fixed nodules. No noted swelling and any tenderness with any of the palpation. Yeah. Okay. So this would conclude our test. Thank you for your help.
Thank you.
Thank you.
Which I'm going to strike the tuning fork and place it on your forehead. If you could just tell me in which ear you hear the tuning fork, okay?
This.
Okay, perfect. Next, I'm going to perform the Rin test, which I will strike the tuning fork and place it behind your ear. And if you could just tell me when you stop hearing the sound, okay?
No.
Okay, and then when I move it to the front of your ear, can you still hear it?
I can't.
Okay, perfect. Next, I'm going to perform this on this side as well. Strike the tuning fork, place behind your ear.
No.
Okay, and then can you still hear it when I move it up past your ear?
I can't.
Perfect. Next, I'm going to perform, I'm going to look inside your ear and just look at your tympanic membrane. So I'm going to grab my otoscope. Oops. And I'm just going to pull back on your ear and up and look directly in. I see the tympanic membrane. It is pearly, it is white. There's no redness, no bulging, no discharge, no perforation present. I'm going to assess the other side. Again, pulling up and back on the ear. Perfect. Pearly white, no discharge, no redness, no perforation, no swelling of any sort. Okay, so next I'm going to assess your nose. I'm going to inspect it first. Everything looks intact, symmetrical, but I'm going to, again, grab my light and I'm going to inspect the inside. So I'm just going to push up a little bit on your nose, and I'm just, if you could lift your head up just a little. Okay, I'm gonna look for any polyps, any redness, swelling, discharge, which there is none present. The inside is just pink, intact. There is no septal deviation. So next I'm gonna move down to your mouth. So the outside, your lips are intact, they are pink. No bleeding, no swelling. If you can just open your mouth for me. All right, and are you able to stick your tongue out and say ah? Perfect. The uvula is intact. The mouth is moist. It's pink. The tongue is pink. The hard and soft palate are intact. If you could just lift your tongue up for me. The sublingual ducts are present. Good dentition. There are no broken teeth. Perfect. Thank you. Are you able to cough for me? I just want to check your gag reflex. Perfect. So gag reflex is present. Next, I'm going to move down to your throat. I'm going to first assess your lymph nodes. Okay. So some lymph nodes I'm going to check for today are the preauricular lymph nodes in front of your ear, then the postauricular lymph nodes behind your ear, the submental lymph nodes under your jaw. Then I'm going to assess for the anterior cervical lymph nodes and then the posterior cervical lymph nodes, which I'm not feeling any tenderness, any hard lymph nodes or anything. Everything is within normal limits. Next, I'm going to assess your trachea. So first I'm going to look at it. There's no tracheal deviation, there's no torticollis or twisting of the neck. I'm going to palpate the trachea, so just displace it to either side. Perfect. Next, I'm going to stand behind you and assess for your thyroid. So, okay, if you could just swallow for me. Perfect. I'm not feeling any goiters. I'm going to Next, I'm going to assess your trachea. So first I'm going to look at it. There's no tracheal deviation, there's no torticollis or twisting of the neck. I'm going to palpate the trachea, so just displace it to either side. Perfect. Next, I'm going to stand behind you and assess for your thyroid. So, okay, if you could just swallow for me. Perfect. I'm not feeling any goiters. I'm going to next assess.
So I'm gonna auscultate his lungs. Before we do the lungs, I'm gonna look at your throat. Lift your head up. Okay, so visually looking at the throat, I don't see any lumps. I'm gonna palpate it. I don't feel any lumps. Do you feel any pain or tenderness when I do this?
No.
Okay, great. So now I'm going to stand behind you and I'm going to put my hands around your neck. I'm going to need you to take a sip of this water, okay? Please sip it when I ask you and then swallow.
Okay.
Alrighty? May feel a little discomfort because I'm going to apply just a little bit of pressure, but I'll let you know when. Okay. You can take the sip. Swallow. Okay. Perfect. So, trach is not deviated. Tips to make sure that there's no clubbing going on.
So the basic clinical exam for the thumb, we're going to start with first looking at an inspection to see if we have any issues with any shouldering, any subluxation radially or volarly. We're going to look at two to see the integrity. Do they look like they have any atrophy in their first web space or any shortening of that first web space? And also getting appreciation for what their resting posture looks like. Do they rest in slight hyperextension or an adducted position of the first metacarpal? Then we're going to go through and assess active range of motion. So I'm just going to ask him to come across to perform opposition. So bring your thumbs across to touch, the base of your small finger, and then come all the way out. So that gives us an idea of how he's moving, both CMC, MP, and IP. Perfect, good. and relax. Now we're going to take a look at his passive motion. So what we're going to do is we're going to first assess, do we have a presence of a capsular pattern at the thumb CMC? So I'm going to come in, I'm going to do a bad handshake, coming in with my thumb and index finger to the base of his first metacarpal, coming up and giving a little bit of overpressure. I'm going to compare that to the uninvolved side here, or the involved side, excuse me, here. Going to the end of the range and giving a little bit of overpressure. Then I'm going to come in and I'm going to passively assess his MP, both with flexion and extension, being cautious with extension not to give too much overpressure, and his IP joint. So coming in and assessing passive flexion. And everybody's thumbs are a little different, so it's always important to test that uninvolved side. Some people don't move a lot at the MP. He's quite stiff with his IP hyperextension. Good. Once we've done our passive assessment, now we're going to go on to our resisted tests. So what we're going to do is we're going to look at the radial sided tendons of FCR, ECR, B, and L. So coming up, I'm going to have you extend here for me. I want your fingers in extended position. We're going to do a resisted test for FCR. I get my propeller wings out, hold that, hold, and relax, and I'm going to passively stretch. So resisted test looking for a tendinopathy, and our stretch test looking for a tenosynovitis. Hold here, don't let me move you. Hold, and relax, and come back. And now I'm going to take a look at ECR, B, and L. So his elbows in extended position, fingers flexed. I'm going to come in here. Okay, keep your wrist in neutral, please. Come up just a little, perfect. And hold that. Don't let me move you. Hold, and relax. And I'm going to come down, passive stretch. Okay, I'll do that same thing over here. Fingers flexed so I don't get EDC. Come in, hold, and relax. And I'm going to come down. Good. Okay, so now we're going to go through some of our resisted tests for the thumb. So we can start off doing hyperextension looking at EPL. So I'm going to bring him in a hyperextended position here. Hold that, don't let me move you. Hold, and relax. And I'm going to do that same thing on the other side, stabilizing his proximal phalanx, come up into hyperextension, and hold that. Good, and relax. Now we're going to take a look at our radial abduction. So I want him to keep his thumb in that maximal loose pack position. I'm going to give you a little resistance. Hold there. Hold, and relax. And we're going to follow up with a passive stretch, where I'm going to have him tuck his thumb in. We're going to do the Eichhoffs, formerly known as Finkelsteins. I'm going to do it in neutral here, as well as in pronation. Good. Okay. Same thing over here. I'm going to come in. I want you to hold that. Don't let me move you. Hold, and relax. Now I'm going to have you tuck in and come down and here. Good. And then in pronation, we're going to repeat that. Perfect. Good. And relax. I'm also going to take a look at his to see if he has any issues with intersection syndrome. I'm going to have him actively come across his palm and then flex his wrist. Here, looking for provocation of pain here in that intersection region, which is 3 to 4 centimeters proximal to Lister's tubercle. So come across your palm, and I want you to flex. Any problem with that? Perfect. We'll continue with our resisted tests. In this position, I want you to hold that. Don't let me move you. So our resistance for palmar and dorsal adduction is going to be at the MP. Hold that. Good. And hold. Good. And then with flexion and hold. And we're going to do that same thing. So our resisted test on the opposite side, we're going to come in. I'm going to perform resisted palmar abduction. Hold that. Good. Dorsal adduction and hold. Good. And hold. Okay. And now we're going to look at FPL isolated. So I'm going to stabilize here. Okay. Come down. I want you to hold that for me. Good. And relax. We're going to follow up with stretch. Going to have forearm and supination, wrist and extension. Any problem with that?
Yep.
Okay. I'm going to come in here. Okay. Hold FPL. Good. And relax. I'm going to come out and I'm going to stretch. So this concludes the basic clinical exam for the thumb.